Good morning, Mundanar. In this class, we are going to discuss about infective and anti-infective. Infective means infection means the infection the caused because of a microorganism that may be bacteria, virus, protozoal. Most of the infections are caused because of bacterial colonization and that resulting in severe infection that resulting in tissue necrosis, factor stimulation. These all the things need to be the consideration. Infection is a systemic disease with the presence of microbes or pathogen in blood. Microbes such as bacteria, virus, fungus, protozoa and rickettsia. Because of bacteria, mostly urinary tract infection, respiratory tract infections are affected. Because of fungus, ringworms or candida infection. Because of virus, HIV, chickenpox, common cold, protozoal infection, diarrhea, dysentery, malaria. These are all the things caused because of microorganism which was in the outer line. In bacteria, we take means there are lot of bacteria cause different disease that should be we have to control in a proper manner. It consists of gram positive bacteria, gram negative bacteria, fungus, virus, chlamydia, rickettsia, mycoplasmas, spirochetes, mycobacteria. Based upon the system, respiratory system, urinary system, incumbatory system, intra-abdominal, gastroenteritis, endocarditis, oncomyelitis, septicemia, meningitis. These are all the infections caused by because of various group of microorganisms, because of virus, because of bacteria, because of more gram-positive bacteria, gram-negative like Streptococcus pneumonia, Streptococcus virulence, like that more bacteria involved in the respiratory disorders. When we come to the outer line of antibiotics, most of the antibiotics are cephalosporin, penicillin, fluoroquinolones antibiotic, macrolides antibiotics, aminoglycoside antibiotics, beta-lactam antibiotics that comes under penicillin, chlamydia, ciprofloxacin antibiotic. These and all comes under various class of antibiotic. This antibiotic is used carefully when we find the disease means. Bacterial infection that occurs initially the bacteria bind to the organism and it make the colonization and it multiply and resulting in tissue injury and cause a severe infection. These are all the infection caused by various microorganisms as discussed before. There are mainly bacteria classified into gram positive and gram negative bacteria. Gram positive bacteria on gram staining it gives blue color. Gram negative bacteria on gram staining it gives teichoic red color. Gram positive bacteria they have peptidoglycan linkage and gram negative composed of teichoic acid. For example, gram positive bacteria example we given in the clearly Streptococcus aureus, Streptococcus pyogenes, Streptococcus viridans, Streptococcus pneumonia, meningococci, cause meningitis, septicemia, urinary tract infection, gonorrhea, sexual transmitted disease. According to the shape, bacilli, rod shape, oval shape, aerobic bacteria, anaerobic bacteria, these are all the different types of bacteria involved in this. Where the bacteria occurs, where is the source of infection? Human are the more commonest source of infection. This could be either through a patient or through carrier, animals, insects, soil and water, food. These are all the sources of infection. Based upon the culture sensitivity techniques, sample is inoculated on the media. A media is a substance on which microorganisms grow artificially for 24 hours to 7 days. After growing, these are subjected to gram stain by couplet method and discouplet method, we can identify the right antibiotic to the patients. The common symptoms, signs and symptoms are clinical features when the bacteria or viral or anything inward. The patient will suffer from fever, chills, myalgia, photophobia, lymphadenopathy, GI abstract, leukocytosis, leukopenia like this. For this infection, antibiotics are the proper choice to control the infection. These are chemical substance derived from living organism like fungi which inhibit or kill other microbes in low concentration. Example, penicillin, cephalosporin. A large number of antibiotics have been synthesized chemically like chloramphenicol, fluoroquinones. Bactericidal drugs are those which kill or eradicate microbes, or bacteriostatic drugs do not kill but inhibit the growth of microorganisms. Outerlinely, types of antibiotic that was classified into penicillin, cephalosporin. Penicillin, first generation penicillins, second generation ampicillin, third generation amoxicillin, cloxacillin, carbamazepine, ticarcillin, mexicillin, piperacillin. When we come to the cephalosporin, mostly cephalexin, cefazolin, cefafarin is the first generation. Most of the antibiotics, ceftriaxone, cefatoxim, cefagidine, that belongs to the cephalosporin antibiotics. Fluoroquinone antibiotics, high likely we can see ciprofloxacin, levofloxacin, moxifloxacin, norfloxacin, that will inhibit the DNA synthesis of bacteria. Aminoglycoside, primarily used to treat gram-negative bacterial infection like amikacin, gentamicin, kanamycin, neomycin, tobramycin. Monobactam, azotyronum and carbapenems, ytterbitum, imipenem and meropenem are higher antibiotics. Macrolide antibiotics it will control the 50S ribosome formation. Example, azithromycin, clarithromycin, clindamycin, diethromycin, erythromycin. Some other miscellaneous and higher antibiotics are vancomycin, rifampicin, doxycycline, linezolid, tetracycline, trimethoprim, sulfamethoxazole. When it is a MRSA, we can use vancomycin antibiotic. When it is a BRSA, linezolid, that stop the growth of bacteria, that will monoamino oxidase inhibitor, dopamine, norepinephrine and serotonin. Based upon the mechanism of action, fewer antibiotic like penicillin, cephalosporin, vancomycin that control the cell wall synthesis, fluoroquinones that will inhibit the DNA synthesis. Protein synthesis inhibitor like aminoglycoside, tetracycline like that, and inhibit 50S subunit like macrolides, chloramphenicol and clindamycin. Then folic acid synthesis inhibitor sulfonamide, trimethoprim and mycolic acid synthesis inhibitor isoniazid. RNA synthesis inhibitor rifampin and DNA synthesis inhibitor fluoroquinone and metronidazole. On the base upon the spectrum of activity, broad spectrum antibiotics like amoxicillin, tetracycline, cephalosporin, chloramphenicol, erythromycin, and short spectrum antibiotic penicillin G, cloxacillin, vancomycin. On the basis of mode of action, bacteriostatic antibiotic tetracycline, chloramphenicol, erythromycin, lincomycin. Bactericidal antibiotic cephalosporin, penicillin, erythromycin, aminoglycoside. In this topic, mostly we need to discuss about rational use of antibiotic. This is what the highest problem in the India, that they read alertness like that. The Conference of Experts on Rational Use of Covered in Nairobi 1985 defined that rational use of drugs that require patients receive the medication appropriately to their clinical need in dose that meet their own individual requirement for adequate period of time at lowest cost to the community. Antibiotic in India, antibiotic constitute 15.7% of drug market, and in UK, antibiotics accounted for 19% of drug market. There are certain guidelines that should be followed before prescribing antibiotic. Guideline based on the best evidence, prescribe only during clinical benefit, best antimicrobial prescribing requiring a understanding of pharmacokinetic of the drugs, their mode of action, a spectrum of activity against infection. Antibiotic resistance means the factor involved in antimicrobial resistance: inappropriate prescription, inadequate dose, poor compliance, use of broad spectrum antibiotic, over counter availability of antibiotics. There are very important guidelines we have to follow. Use of antibiotic only when indicated, and gram staining method should be done before commencing the antibiotic therapy. The choice of agent should be based on the spectrum of activity. An adequate dose and duration of therapy should be consistently maintained to the patient. Before prescribing the antibiotic, history and allergy of the patient should be known. And prophylactic use of antibiotic should be restricted. Antibiotic therapy directed at specific organism should include most effective, least toxic and narrow spectrum agents. Oral therapy is preferred than parenteral therapy whenever clinically possible. Antimicrobial combination should be used whenever indicated. Topical antibiotics should not be used when it was highly proven. Empirical antibiotic therapy should be prescribed based upon the local epidemiology data. Empirical therapy is medical term referring to initiation of treatment period to the determination of firm diagnosis. Example of this include antibiotics given for pneumonia, urinary tract infection, suspected bacterial meningitis in newborn aged 0 to 6 months. In the next class, we are going to discuss about different site of infection or different surgical site. What are all the antibiotics utilized? We are going to see in the next session. Thank you.